My name is Emma DiFilippo. I'm a fourth-year medical student at the Mayo Clinic, and I'm going to present a poster on a paper that our group wrote that's entitled Clinical Applications and Utility of a Precision Medicine Approach for Patients with Unexplained Cytopenias. So starting with some background, our group studies disorders that lead to bone marrow failure, and this is when the bone marrow is unable to replenish at least one of the cell lines, including red blood cells, white blood cells, or platelets. This leads to cytopenias, and it's often difficult to identify a cause in certain patients. Bone marrow failure can be the isolated feature in a patient, but it can also portend a more serious condition, such as myelodysplastic syndromes or leukemia. However, the ways in which bone marrow failure can evolve into these diseases is not yet known. We do know, however, that several bone marrow failure disorders have an underlying genetic cause. And therefore, next generation sequencing, or NGS, has been really key in helping us detect and diagnose patients with genetic bone marrow failure disorders. So to help better care for such patients, Mayo started the Pre-Myeloid and Bone Marrow Failure Clinic. The founding purpose of this clinic is to use genomics and translational studies to diagnose and manage patients that have some of these precursor features of myeloid neoplasms, but don't yet meet diagnostic criteria for malignancy. The clinic utilizes NGS to identify new genetic targets that might be involved in the development of bone marrow failure disorders and myeloid neoplasms. And these genomic results also help us better understand which patients are at the highest risk of disease progression. So additionally, we can use functional studies to characterize the potential implications of variants of unknown significance that are identified via NGS. And my colleague Alejandro Ferrer will discuss that in a little bit. So next, I'll highlight the diagnostic algorithm that was published in the paper, and this can be found in the center of the poster. Patients can be referred to the clinic from a variety of providers, whether that's their primary care provider or someone else, and that's after they present with persistent, unexplained cytopenias. Persistent in this case meaning lasting at least 6 months. If there is clinical suspicion of an underlying genetic disorder, whether due to a family history of cytopenias or the patient themselves having features of a bone marrow failure disorder, the patient will undergo exome splice testing, which then leads to either a diagnosis or further testing with research whole exome sequencing, depending on the results. In patients without such features or without a family history, they'll undergo NGS testing with a panel of myeloid relevant genes that's listed in full in the paper. And then the NGS results will lead to a diagnosis of either idiopathic cytopenias of undetermined significance, or ICUS, or clonal cytopenias of undetermined significance, or CCUS. Of note, patients in which we suspect of having Fanconi anemia or short telomere syndrome, they will undergo specific functional studies like chromosomal breakage assay or FLOFISH, respectively. It's also to note that while new technologies like NGS and whole exome sequencing provide us with a plethora of data, we are uncovering many novel variants for which we have very little information regarding their pathogenicity. And so after starting this project, the group really quickly realized that these clinical studies and NGS were not going to be sufficient to fully evaluate these variants of unknown significance. And as such, they felt that they needed to invest more time in research testing to better characterize these variants. So I'll turn it over to Alejandro Ferrer to discuss how variants of uncertain significance are assessed in the research lab.
Thank you, Emma DiFilippo. As you were saying, I'm Alejandro Ferrer. I'm a researcher at the Center for Individualized Medicine, and my main work in this project has been to provide research support to the clinical efforts for these patients. So my background is in genetics and biochemistry, and as such, my job is focusing on trying to provide more information about these variants of uncertain significance, or VUSs. This is one of the main problems or issues when working with next generation sequencing technologies, and most of the time, and most of the clinics just focus on the clinical results on variants that have been identified. But in our case, we wanted to do some extra step that could help us, increase our solve rate. So when we identify a variant of uncertain significance, the first thing we do is we do in-depth analysis of that variant, focuses on that variant. It's also a very common misinterpretation that when a gene that is related with a disease have a variant, a genetic variant is automatically the cause, explaining the cause of that patient. That's not always true. So that's what we focus on the variant specifically. We start with an in-depth literature research about that variant and the gene. We also use several in silico prediction and a lot of tools that we have at hand to actually try to get as much information as possible for that variant. Then once we have all this, we summarize all these results and we present them in a pre-myeloid genomic tumor board, which is a meeting that includes people from different backgrounds, including physicians, researchers, clinical coordinators, nurses, anyone who is involved in the case and can provide anything to solve it. We discuss these results together, and then sometimes we can discard the variant because there's not enough evidence that supports that the variant is pathogenic. But sometimes we agree that the variant could actually be related to the disease. So what we do is we try to look for options in a research site that can help clarify if the variant is pathogenic or not. So this depend a lot in the variant itself and also in the gene and the pathway that the gene is involved with. We can do like just adding other omics technologies like RNA-seq or methylation assays. Sometimes we just do in vitro assays and cell-based assays. As I say, it depends in the genes, very specific of the gene. And for this, in the interest of time, I'm not going to go into a lot of depth. What I want to highlight is that a lot of these research options are actually collaboration with outside institutions. There are people, there are laboratories out there that have been focused on specific genes for years, and they're expert in these genes. So what we do a lot of times identify these experts outside or inside Mayo. We propose this, and then we start collaboration with this group. One of the main collaboration we have is the University of Minnesota regarding the short telomere syndromes. So in summary, we do all this research, and depending on these results, we can discard the variant as pathogenic if the results indicate that the variant is not pathogenic, or if the results are indicative that the variant could actually be indeed pathogenic and related to the phenotype, we reach a diagnosis, and then we confirm the variant in a CLIA certified laboratory, and then usually we publish these results. So that's in a nutshell what we do in the research side. The clinic has been expanding since then, but I will ask Emma to expand on that again. So, thank you, Emma.
Thank you. Yeah, thanks. So now I'll just highlight the results that we obtained through the clinic at the time of publication, and this is depicted in the pie charts in the upper right-hand portion of the poster. So at the time of publication in 2018, 68 patients had been evaluated through the pre-myeloid and bone marrow failure clinic. Of those 68 patients, 30 were diagnosed with cytopenias without a known clinical syndrome. 24 were diagnosed with an inherited bone marrow failure syndrome, and 14 were classified as other, which I'll expand on shortly. So of those diagnosed with cytopenias without a known clinical syndrome, the majority were determined to have CCUS, and then about a quarter of patients were diagnosed with ICUS, and this was all based on NGS results. And then for those diagnosed with an inherited bone marrow failure syndrome, the distribution of conditions is also in the pie chart, but ultimately 13 patients were diagnosed with short telomere syndrome, 6 patients with GATA2 haploinsufficiency, 2 patients with Diamond-Blackfan anemia, and 1 each with Fanconi anemia, severe congenital neutropenia, and DADA2. And then finally, the patients that comprise the other group include 7 patients with familial myeloid predisposition syndromes, 2 patients with HLA-DR15 positive bone marrow failure syndrome, and then 5 patients that still had an unclear phenotype for their underlying bone marrow failure disorder after all the research testing. And I think that's something that's really important to highlight, is that of the 68 patients that were reviewed in this paper, a quarter of those had a change in their clinical management as a result of the genetic testing results. So these included anything from like a change in donor selection for allogeneic stem cell transplant, choosing a reduced intensity conditioning regimen prior to transplant, and then also starting new medical therapy such as danazol for patients with short telomere syndrome. So in conclusion, this paper promotes the notion that precision medicine does meaningfully impact the care of patients with unexplained cytopenias. The extent of testing, including functional studies and whole exome sequencing, does require a multidisciplinary approach. in our case, we had clinicians from multiple disciplines, biostatistician, molecular biologists, nurses, and more. Some limitations of this type of work. One is that there is a high likelihood, of course, that there exists as yet unidentified bone marrow failure relevant genes. And so with the current assays that we have, we're not fully testing for everything that's out there. Additionally, there are often no relevant functional assays to assess some of the mutations that we have found, but these remain areas for growth and further exploration. And then in terms of our work since the publication of this paper, the clinic has now evaluated close to 200 patients. And these workups have been incredibly helpful for patients and their families in terms of finding new diagnoses and referring family members that also might be affected with this condition. And so as a result of the success of this endeavor, the Mayo Clinic continues to support this clinic and other similar clinics that have been founded in the last couple of years. Thank you.